Chapter 6, Urinary System. Some terms not built from word parts. We have acute kidney injury, that is abbreviation AKI, and that is a situation where there's an abrupt decline in kidney function, and this may happen over days or weeks, and it is not reversible. It's also another abbreviation that we would see here is acute renal failure. End-stage renal disease, and this is a very common abbreviation here, ESRD, and what that means is that there's a condition in the kidneys where they're no longer functioning as they need to, and it typically results in dialysis being having to be instituted at that point, and quite often it would also result in transplant of kidney. Hypospadia. This is where there's a congenital defect, and the urinary meatus is located for males in the underside of the penis, or it can be located in different locations than normal for the female as well. Renal hypertension is an elevated blood pressure because of kidney disease. Urinary suppression is where there's a sudden stoppage of urinary formation in the kidneys. Surgical terms from word parts are cystotomy, and that is a creation of an artificial opening, which is the ostomy, and then the cysto part means bladder. Nephrectomy, ectomy is going to be excision. Nephro is kidney, so this is excision of the kidney. Nephropexy, pexy means surgical fixation, so this is surgical fixation of the kidney. Plasty means surgical repair, and then pylo means renal pelvis, so this is surgical repair of the renal pelvis. Vesicourethral suspension, this is suspension that relates to the bladder and the urethra, where it has maybe drooped or relaxed down, and they are basically suspending it back up. Extracorporeal shockwave lithotripsy, ESWL, is a non-invasive procedure, which means it doesn't go inside the body, and it is a procedure whereby stones are crushed when patients have kidney stones or urethral stones, and it's done by shockwave. Fulguration is destroying of tissue with an electrical spark, and renal transplant is implanting of a donor kidney from someone into the patient in order to restore their renal function. In the second part of the chapter, we're going to pronounce, define, and spell diagnostic terms in the urinary system and complementary terms in the urinary system, and also interpret the meaning of abbreviations related to urinary system and look at some medical language in clinical concepts. Diagnostic terms from word parts include cystoscope, and that is an instrument used for visual examination of the bladder. Nephrosonography is a process of recording, which is the graphy, of the kidney using sound waves, and sound waves is the sono part. Renogram is a radiographic record of the kidney. So a record is the gram part here. Voiding cystourethropy, or VCUG, is a radiographic imaging of the bladder and the urethra. Some diagnostic terms built from word parts, and the first three of these are going to be laboratory-based terms. The first being blood urea nitrogen, or very commonly referred to as BUN. It's a test to measure the amount of nitrogen in the blood that comes from urea, and in detecting abnormality in renal function. Creatinine is a test to measure the amount of waste product in the blood, looking from normal wear and tear of muscles. And in the elevation here, you're looking at a problem in kidney function. Specific gravity is a test where the urine is measured poor concentrating or diluting ability of the urine. And then urodynamics is actually a procedure that is determining the force and flow of urine from the urinary tract. And this is done a lot of times in patients who maybe have males who have maybe prostate enlargement and that kind of thing, where they're getting some stricture that doesn't allow flow at a very high rate. Complementary terms from word parts include anuria is referring to urine or urination, and then we just add in the additional component here. So anuria means the absence of urine. Dysuria means typically a painful urination, may also mean difficult. Glycosuria means glucose in the urine or sugar in the urine. Hematuria means blood in the urine. Nocturia means night urine or night urination in this case. Olguria, scant is the definition of olgi, so this is scanty urine. Poly means much or many, so that is polyuria. And pi means pus, so this is pyuria or pus in the urine. Terms not built from word parts include diuretic, which is an agent, and in most cases we're referring to a medication here that helps to promote or increase the formation and excretion of urine. Hemodialysis, HD is a common abbreviation here. It's a procedure for removing blood impurities from the urine and because of an inability of the kidney to function and do that on its own. Peritoneal dialysis is a procedure for removing toxic waste from the kidney when the person is not able to do so with their kidneys naturally. And in this case, there's a peritoneal device put in, or a device put in the peritoneal cavity in order to produce that. Stricture is an abnormal narrowing, and a lot of times this is a urethral narrowing in this system. Abbreviations: AKI, which we've looked at already, but it's acute kidney injury. CRF means chronic kidney disease. ESRD, which is very common, is end-stage renal disease. It's probably one of the most common abbreviations in this particular chapter. SG is specific gravity, and UTI means urinary tract infections. And probably the last three of these are probably the ones you will see most often. I'm going to read through some clinical information here, and I would suggest as we do that you actually try to pronounce yourself the terms that are bolded. This is part of helping you learn how to pronounce the terms. And while some of these we may all stumble over a little bit sometimes, even if you've been in healthcare for years, they are it's much different in reading them and thinking them than it is to actually pronouncing them. So I encourage you to pronounce them as we go. The 76-year-old woman consulted with her primary care physician because of hematuria and dysuria. She was referred to a urologist. Urinalysis disclosed 1+ albumin and mild pyuria, in addition to the hematuria. A spiral CT scan was obtained. A mild nephrolithiasis was observed with no hydronephrosis. Finally, a cystoscopy was performed, which showed mild cystitis. A urinary tract infection was diagnosed, and the patient responded favorably to antibiotics. The urologist did not advise lithotripsy for the renal calculi.